When should you worry about umbilical cord bleeding? When should you worry about umbilical cord bleeding? This is a common concern for new parents, and it is important to know what to look for. A small amount of bleeding from your newborn's umbilical cord stump is usually normal. This can happen as the stump dries and falls off in the first few weeks after birth. You might see a few drops of blood or slight spotting, especially if the diaper rubs against the area. However, there are certain signs that should prompt you to seek medical advice. If the bleeding is active, persistent, or bright red, it is time to call your healthcare provider. If you apply direct pressure for 10 minutes twice and the bleeding does not stop, that is also a reason to reach out for help. Gushing or heavy bleeding is an emergency. If you notice this, you should seek immediate medical attention. Other signs that requiring prompt evaluation include bleeding that covers an area larger than about 2 inches or 5 centimeters. If you see red streaks or spreading redness around the belly button, that is also concerning. If there is pus or a cloudy, foul-smelling discharge from the stump, or if the skin around the umbilical area feels warm, swollen, or painful to touch, these are red flags. Additionally, if your baby develops a fever over 100 degrees Fahrenheit or 38 degrees Celsius, this is a sign that something may be wrong. If the umbilical cord stump remains attached beyond 3 to 6 weeks, or if your baby looks or acts abnormal in any way, do not hesitate to contact your pediatrician. Infections can cause redness, swelling, discharge, and fever, and they need prompt treatment to prevent further issues. For typical care, keep the umbilical stump clean and dry. Avoid covering it tightly with the diaper, and gently clean around it if needed. It is normal for there to be slight bleeding or moisture during the healing process. However, active bleeding or signs of infection should be addressed quickly. As a millennial mother managing newborn care, it is essential to balance vigilance with calmness. Knowing that minor spotting is common can help ease your worries. However, being aware of when to act is vital for your baby's health. Keeping your pediatrician's contact information handy and monitoring the stump daily can provide reassurance during those first weeks. If you notice anything unusual or persistent bleeding, do not hesitate to reach out to your healthcare provider for guidance.